Hello everyone, welcome to Dental Subjects. Today's topic is about the maxilla, a facial bone. Okay, let's get into the topic. Maxilla is the one of the facial bone. It is the second largest bone of the face. First being the mandible, right? We already seen about the mandible in the previous class. Okay. Maxilla is a paired bone. Okay, it is not a single bone. It is a paired bone on either side of the face, in right and left side. It joins to form the part of the mid face, especially nose, mouth, orbit, etc. And it also forms the upper jaw of the mouth. Okay, it mainly consists of body and four processes. See the diagram: frontal process, zygomatic process, palatine process, and alveolar process. These all together form the maxilla. Okay, it plays an important role in mastication, speech, and facial expression. Okay, next, the development and ossification of maxilla. We already seen about the development of maxilla in the dental embryology class, right? Yes. During the 6th week of the intrauterine life, the maxilla starts to develop from the walls of the stomatorium. Then it grows medially and fuses together to form the maxilla. Okay. Then during the 6th week of the intrauterine life, the ossification of the maxilla also starts. Okay, maxilla ossifies mainly by the intramembranous ossification. The ossification occurs in three centers of the maxilla. First one appears during the 6th week of the intrauterine life. In which part? In the canine fossa. Okay, canine fossa is nothing but a depression like structure found above the canine, that is third teeth from the midline. Okay, then the second ossification center appears above the incisive fossa. Incisive fossa is nothing but the small depression found in the incisive part, that is in the anterior part of the mouth. Okay, it occurs during the 7th week of the intrauterine life. Then the third center, it appears at the ventral margin of the nasal septum. Okay, during the 10th week of the intrauterine life. This is how the ossification starts and proceeds forward to form the whole maxilla. Okay, but the ossification, the completion of ossification occurs only after the birth. Okay, then the anatomy of maxilla. As we already seen that maxilla has a body and four processes, right? Now we are starting with the body of maxilla. Body of the maxilla is pyramidal in shape. Okay, its anterior surface is concave in nature and the posterior surface is convex. Okay, now we are going to see about the important anatomical landmarks and the corresponding muscle attachments. Okay, first one is the incisive fossa. We already seen that incisive fossa is nothing but a slight depression above the incisor teeth, right? It gives rise to the depressor septi muscle. Okay, then the canine fossa. Canine fossa is the deeper depression above the canine teeth. It gives rise to the levator anguli volus. Okay, just see the diagram. Then the infraorbital foramen. This is the infraorbital foramen which transmits the infraorbital nerve and vessels. Okay, see the levator labili superioris is a muscle which arises between the infraorbital margin and the infraorbital foramen. Okay, see the diagram. This is the infraorbital margin. In between this foramen and the margin, there is a muscle. It is known as the levator labii superioris. Then the nasal notch. Nasal notch is nothing but a deep concave border in the nasal area. See the diagram? There's a concave border, right? This is known as the nasal notch. It gives rise to the nasalis and depressor septic muscles. Okay. Then the maxillary tuberosity. Maxillary tuberosity is a rounded eminence usually seen at the end of the upper arch. Okay, see the diagram. Behind the teeth there is a projected eminence, right? This is known as the maxillary tuberosity. In palatal aspect, we can clearly see the maxillary tuberosity. Okay, it gives rise to the superficial head of the medial pterygoid muscle. Okay, now we are going to see which are the parts are formed by the body of the maxilla. Okay, which is partly or completely. Okay, first the infratemporal fossa. The infratemporal fossa is formed by the combination of bones. Okay, this body of maxilla forms the anterior wall of the infratemporal fossa. Okay, now the pterygopalatine fossa. Okay, it is a small depression found within the skull. Okay, it is situated between the maxilla, sphenoid, and the palatal bones. Okay, its anterior wall is formed by the this body of maxilla. Okay, above the maxillary tuberosity. Okay, then see the nasal part. Okay, this body of maxilla forms a part of the lateral wall of the nose. Okay, then it also forms the maxillary sinus. There is a large opening, right? It is known as the maxillary sinus. Okay, it also gives rise to the maxillary hiatus. Maxillary hiatus is nothing but there is a irregular opening. Okay, this in the maxillary sinus. Okay, this is known as the maxillary hiatus. Okay, okay. It also forms the inferior meatus of the nose. Okay. Next part is the greater palatine canal. Okay. Due to the articulation of the palatine bones and the hiatus, it forms the greater palatine canal. Okay. Which is very important because it transmits the greater palatine vessels and the nerves, orbital parts. See the part. This body of maxilla forms the greater part of the floor of the orbit. See the diagram. This is the floor of the orbit. Okay. Medially, it is continuous with the lacrimal crest of the frontal process. Okay. Posteriorly, it forms a part of an anterior margin of infraorbital fissure. See the diagram. It is known as the infraorbital fissure. Its anterior margin is formed by the body of maxilla. Next, the nasolacrimal canal. Okay, this nasolacrimal canal is also formed by the contribution of the medial border of the body of maxilla and the lacrimal bone. Okay, then the processes of the maxilla one by one, starting with the zygomatic process. Zygomatic process is a strong quadrilateral projection from the upper body of the maxilla, right? It is projected laterally, that is, it is away from the midline and slightly backward. Okay, it has a upper rough surface, okay, for its articulation with the zygomatic bone. Okay, it articulates with the zygomatic bone to form the zygomatico-maxillary suture. It gives rise to the lateral wall and the floor of the orbit. Okay. What are its importance? It provides attachment for the muscles of facial expression and also helps in transmitting forces of mastication. Okay, to the rest of the facial skeleton, and its important role is the structural integrity. Right, it provides the facial prominence. Right, then the frontal process. Frontal process is a strong vertical projection. See the diagram. arising from the superior aspect of the body. Okay, it ascends to articulate with the frontal bone, right? Likewise, the zygomatic bone, it zygomatic process, it also has a upper rough surface to form the articulation. Okay, it is usually triangular in shape. It forms the anterior part of the medial orbital margin. Okay, it also contains the anterior lacrimal crest. Okay, it articulates with the frontal, nasal, lacrimal and the ethmoid bone. Its important functions are it supports the bridge of the nose. See the diagram. It also forms the medial wall of the orbit. It gives attachment to the medial palpebral ligament and also forms the anterior boundary of the lacrimal groove. Okay. Then the alveolar process. Okay. Alveolar process, see the diagram. It implies it is the tooth bearing area, right? It supports the maxillary teeth and the dental arch, that is the upper arch. Okay. Okay. It is separated from the body by the alveolar margin. Okay. Its main function we already see, it forms the dental arches and forms the sockets, and also it distributes the occlusal forces to the maxilla. Okay. It also maintains the shape and integrity of the dental arch. Okay, it provides attachment for the gingiva and the periodontal ligament. Okay, then the palatine process. Palatine process is a horizontal plate-like projection from the upper part of the maxilla. Okay, it forms the anterior 3/4 of the hard palate and separates the oral and nasal cavity. It is very important. It is the structure which separates the oral and nasal cavity. Okay. It extends posteriorly and medially from the body of the maxilla. Okay. Then it forms the orbital surface superiorly. Okay. Now we are going to see about the articulation of maxilla. Maxilla has so many articulation. It has attachments with many bones to form the midface. Okay. It also by this articulations it provides stability to the midface and the surrounding structure. Okay. Superiorly, that is above, they articulates with the three bones, that is nasal bone, frontal bone and the lacrimal bone. Lacrimal bone is nothing but the bones present in the eye part. Okay. Medially, in the central region, it articulates with the five bones. Okay. That is ethmoid bone, inferior nasal concha, vomer bone, palatine bone and the opposite maxilla. Okay. Then laterally, that is away from the midline, it articulates with one bone, that is zygomatic bone. In all this articulation, there will be a formation of suture. Okay. Finally, the age-related changes in the maxilla. At birth, the transverse and anteroposterior diameters are more than the vertical diameter. Okay, that is the height is less when compared to the length. Okay, in birth, the frontal process is well marked, and also the body consists of more than the alveolar process. Okay, so that the tooth sockets are reaching nearly the floor of the orbit. Okay, it is present. Likewise, the teeth roots are nearly close to the orbit. In the adult stage, the vertical diameter becomes greater. Okay, it is because of the development of the alveolar process and increase in the size of the sinus, that is the maxillary sinus. Okay, in the old age, again the condition becomes reverse. Okay, the height is reduced because of the in the old age the teeth fall out and the alveolar process becomes observed. Okay, due to that the height is reduced. Okay, these are the age changes of the maxilla. Okay, this is the end of our class. If you have any doubts, please kindly share it in the comment section. Thank you.